Greetings of the day. Today we are going to talk about rehabilitation psychology. I hope this topic is pretty familiar to you all. So let's start with the definition of rehabilitation psychology. It is a study and application of psychological principles on behalf of persons who have disability due to injury or illness. So basically, rehabilitation psychology is a study or application of psychological principles to benefit persons with PWDs, persons with disabilities. So rehabilitation psychologists often work as a team to assess, treat various disorders like cognitive, emotional, functional disabilities of individuals. Disabilities itself is a spectrum term which may be which could be physical, psychological, cognitive, language, and so on, and help people to overcome barriers and participation in life activities. We know that disabilities can make a person triggered, which will limit him from participating in day-to-day activities. So, rehabilitation psychologists are involved in practice, research, and advocacy with a broad goal of fostering independence, and opportunity for people with disabilities. So, recently, we are more open towards accepting each individual as unique and special, and rehabilitation psychologists help them to foster independence, freedom, and opportunity to take part in activities as other people. So, rehabilitation, as the definition of rehabilitation as a process, is a set of interventions designed to optimize functioning, reduce disability in individuals with health conditions in interaction with their environment. We should keep this in mind that people have disability has more issues when they have to communicate or interact with the environment. Rehabilitation psychologists were usually are have specialized knowledge in regard of evaluation and treatment of emotional coping, mental psychological status, and behavior that promote positive adaptation to disability. They also have detailed knowledge of specific disability conditions, family dynamics, team dynamics, and leadership, which can actually impact the individual along with the social struggles faced by the people, including prejudication, stigmatization, disability related laws, and policies. The speciality of rehabilitation psychology addresses behavioral and mental health issues faced by individuals across the lifespan who are affected by any injury or chronic condition that lead to disability, including emotional coping, behavior that promotes positive adaptation, minor adjustments. So, according to WHO, health is defined as a complete state of physical, mental, and social well being, and not merely the absence of infirmity or disease. And WHO outlines three primary levels of disease prevention, which are primary, secondary, and tertiary. You might think why we are talking about it, because this is the introductory part of health and rehabilitation, where we have to talk about health, disability, and what are the universal or the worldwide recognition towards health or disability, and how disability can be identified, and how health should be identified. So here we might be discussing about primary prevention, secondary prevention, and tertiary prevention. Where primary prevention is, from the name itself, it has been clear that it's more about prevention of something, which include in our community is more about immunization, vaccination, oral hygiene, education, like giving people psychoeducation or primary prevention methods. While secondary prevention include early detection and intervention specific disease, could be autism. When you are a psychologist, you will be more aware of developmental disorder. Early detection intervention can be considered as secondary prevention. While tertiary prevention is explained as a measure taken to minimize the consequence of disease. So that's what we basically do as a rehabilitation psychologist. So disability, we use specific terms which actually used as synonyms, but still they have varied differences in the context. First one is disability. It's a condition of body or mind that make it more difficult for a person to with that condition to do certain work. It's more like activity is being limited or disability, and it like actually hampers the individual to work effectively with the environment. There are basically four forms of disabilities: behavioral, sensory, physical, and developmental. Impairment is the abnormality or loss of a particular anatomical structure or function, and all impairment might not lead to disability. Some impairment would be very minimal that won't affect the overall functioning of the individual. While handicap is basically the social constraints that is experienced by the individual, which include the disadvantage of a given individual in their social context from an impairment or disability that limit or prevent the fulfillment of a role that is normal to other individuals. Need of a rehabilitation psychology. Now we are going to talk about the need. The main need of rehabilitation psychology is that it addresses the complex interplay of physical, psychological, and social factors affecting individuals with disabilities. It helps in understanding, managing adjustment to disability, including emotional and social challenges. It identifies barriers to recovery while fostering personal strength and resiliency. And the specialty supports maximizing independence, social participation, and vocational functioning. It works with interdisciplinary teams to promote holistic care, aiming to improving patients' daily functioning in living and working environments. And the field plays a pivotal role in public policy making, advocacy, program development, education to improve the societal attitudes towards people with disabilities. So today in this class, we discussed about rehabilitation psychology, rehabilitation as a process. We discussed about health, and we discussed about WHO's definition on health, and various forms of prevention, how prevention policies actually work. We discussed about the difference between impairment, disability, and handicap. And at the end, we discussed about need of rehabilitation. So that's it for the day. I hope this is fine for you. And thank you so much. Have a nice day.